and thanks for being here. Many years ago when I first moved to Salina, Glenda helped me buy my first home. And she's from my hometown in Boisington, so I feel very honored and special to be here tonight. I wanted to visit with y'all a little bit about colon cancer, which is what stole Glenda from us. Because I think one of the unique, promising things about colon cancer is that it is totally preventable. So we know that most colon cancer starts as little precancerous growths or polyps, and if I find one of those polyps during a colonoscopy and take it out, we can prevent colon cancer. So one of the messages I wanted to convey to you all tonight is to get your colonoscopies done. Yeah. We do have a change in recommendation. It used to be that we'd recommend colonoscopies at age 50 for people at average risk. That age has now been lowered to age 45, actually, because we're seeing a significant increase in younger people with colon cancer. So an average risk person is one who doesn't have a strong family history, doesn't have risk factors. So really think about visiting with your doctor and getting your colonoscopy scheduled, because it's just a shame when it is a preventable cancer. When you think about cancer, obviously we do have risk factors. Some of those are in our control. With colon cancer, one of your biggest risk factors is family history. So it is a cancer that runs in families. So please don't be embarrassed to talk to your family members. Great Thanksgiving topic. Has a colonoscopy. But really knowing if there's polyps in the family, if there's colon cancer in the family, that really helps strategize your risk. So please know your family history. Know that there are other risk factors as well. But talk to your doctor about it. Really be proactive. I just encourage you to do that in honor of Glenda and others who fought that disease. The other thing to talk about tonight is not quite as rosy or optimistic, and that's pancreatic cancer. Pancreatic cancer is common. It's the fourth most common cause of cancer death in the United States. Colon cancer is the third. But the bad news about colon cancer is that when we find it, it's usually too late. So often when we determine that the tumor's there, it's already spread. It's usually not resectable. So the 5-year survival rate for pancreatic cancer is probably on the order of about 25%. Unfortunately, there's not a screening program for pancreatic cancer, but new guidelines say that if you have a family history of pancreatic cancer, there is screening that you can do. And fortunately, a lot of insurance companies just recently have come on board and are covering that screening. So again, know your family history. If there's pancreatic cancer in the family, talk to your doc about being screened. So there are some modifiable risk factors for both colon cancer and pancreatic cancer. Christina could give this lecture because I'm sure she's given it to you all the time. Low sugar, high fiber, exercise, limited alcohol, no smoking will modify you and decrease your risk. Limited. I said limited. All right.
Thank you, Dr. Ellis.
That would help. Anybody have any questions for me at all?
What are the first two most common? You said pancreatic and colon.
I'm a gut and butt doctor, so I bet breast is probably in there, but I really don't know, honestly.
Okay.
Yeah. I can tell you the order that.
On the generation factor of the family history on the pancreatic cancer, what is you said they're testing to check?
Right. Yeah, so basically we do a specialized scan called an MRCP, and often do a scope with an ultrasound on the end and look at the pancreas up close and personal. So
really?
Yeah, what we're looking for is, early pancreatic cancer when it's very small, and then we can resect it.
Yeah, Piggy's was the size of my thumb.
Yeah. So if you can catch it like that, much greater prognosis. Yeah.
How early do you start screening for that?
Depends on your family history. Yeah, so it's quite early.
So our families
Say
had
randomly your mom, just hypothetically.
So if it's just one family member, probably they won't recommend screening. It usually takes 2 family members before they'll pay for screening. Huh?
A cousin?
Like a cousin?
No, probably not. I checked.
What about a mom and a cousin that were both on the same side of the family?
had the same situation?
Yeah, again, those guidelines are changing, they're in flux, a lot of insurance isn't covering for it, but I tried.
Sure, and ask.
Yeah, ask and see if you could get it covered.
Right.
Yeah, and again, as a general rule, probably 10 years before the first stage of diagnosis of a relative.
Well, that personality check with your pancreatic cancer or pancreas, is that something can be happening here, that happens at Tammy Walker, or is that KU Med Center?
No, we
Is
do
that
it here.
Here?
We do it here.
Okay.
Yeah, sure do. Yeah, in fact, I had my husband do it a year ago because his mother and his maternal grandmother both died of pancreatic cancer. So we tested it out. There was a little bit of a deductible, but not bad. That was Blue Cross. Yeah. Okay, thank you guys.
Thank you, Dr. Ellis.